If you're watching this, you've probably noticed something about your baby. Maybe they always look to the right when they sleep, or they tilt their head like they're going to ask you a question. Then you might have jumped on Google and seen a big, scary word, torticollis. I want you to take a deep breath. Torticollis is just a medical word for a tight neck. It is very common and is also treatable. Today I'm going to show you how to help your baby fix this tight neck right at home with simple play. No scary equipment needed. So what exactly is happening? Why is your baby stuck looking one way? I want you to imagine the muscles on the sides of your baby's neck and that they act like a zipper on a jacket. When we look straight ahead, the zipper is open and they're loose. But with torticollis, it's like that zipper has been pulled all the way up on just one side. And so that side that is closed is tight and it pulls the ear down in that direction. It pulls the ear down towards the shoulder and turns the face away. Because the zipper is stuck, your baby can't look the other way comfortably. Now our goal, mine and yours, is to slowly unzip that muscle and make it loose so that your baby can look both ways and pretty much look wherever they want. We can start unzipping that muscle just by changing how we carry them. This hold is one of my favorite holds and it's called the football hold. Let's assume, for the sake of argument, that your baby has left side torticollis, which means that your baby tilts their head towards their left side and rotates their head to the right. The torticollis is always named for the tilt. So if your baby is tilting their head to the left side, your baby has left side torticollis. Now I'm going to demonstrate for you using this doll. Start off with your baby facing away from you. Now, as we said, baby has a left side torticollis, so her head will be tilted towards her left side. Now, this is what I want you to do. Put the left side downwards like this. Use your right arm, pass your right arm in between baby's legs and hold baby's left shoulder down so the baby is trapped up against your body in this position. Once again, we're treating a left side torticollis, so baby's neck will be tilted down this way. You're holding baby's left shoulder down with your right arm. You're then going to take your left arm and put it across baby's chest so that baby's head is resting gently on your arm. And just holding baby in this position, you can see a baby's right ear has moved up towards baby's right shoulder. And now just holding baby in this position, you can walk around in this position. You can sway baby side to side if you're sitting down. You can look at baby, talk to baby, sing to baby in this position while you're moving around, holding your baby in a football hold, and you're gently stretching baby's tight left side torticollis. Next, we're going to do a gentle stretch with baby lying on their back. And you kneel close to baby, and we said the baby had a left side torticollis. So you're going to hold down baby's left shoulder with your right hand and gently take your left hand, hold the top of baby's head, and just gently move baby's right ear towards her right shoulder. And now you're again stretching the muscle on the left side of your baby, and that will help to relieve that side bending, tilting towards the left side. The next stretch is tummy time with a toy. And what you're going to do is just put your baby on your tummy, use a toy to get their attention, and cue baby to rotate their head towards their non-favorite side. This one is actually quite easy and self-explanatory. You can put your baby on a boppy if your baby doesn't really like tummy time, and just cue baby to track the toy from side to side. By following the toys with their eyes, they will actively turn their head. This will help to strengthen the weak side of the neck and stretch the tight side at the same time. So there you have it, 3 simple stretches that you can use to help correct your baby's torticollis. I know doing these exercises can feel intimidating. You might worry if you are hurting them, but remember, we're just unzipping the zipper. I also want to mention something that scares a lot of parents. You might feel a small lump in your baby's neck muscle. Please do not panic. That is not a tumor. It's just a muscle knot, like a bunch of rubber bands. As you do these stretches, that knot will smoothen itself out. By doing these movements, you're also preventing flat spots and keeping their hand nice and round. You don't need to be afraid. You just need a little patience and lots of play. If you found this video helpful, subscribe for more developmental tips. Hit that like button, and I will see you in the next video. I have a whole series on helping your baby hit their milestones, so be sure to check those out next. I'll see you in the next video.